Hi everyone, this is Nilanjana coming back with a video on ADHD. Nearly every third or fourth parent that I see in Australia is worried that their child has ADHD. And like everything else, wherever there is concern, wherever there is insecurity, there will be a group of people who will take advantage of this worry, of this anxiety and insecurity. The problem here is that ADHD is very difficult to diagnose, and once it is diagnosed, the child stays on amphetamines for the rest of their life. Now, say for example, if the child actually has ADHD, is diagnosed as ADHD and stays on amphetamines, well and good, there is no problem there. But if the person who's making the diagnosis is not really qualified, is in a rush to make the diagnosis, or is just playing into the parents' concerns, then for no reason and for no diagnosis or no ADHD, the child is going to spend the rest of their life on amphetamines. This has serious consequences for the child because it can affect his brain development, his nervous system. If he doesn't have the problem, he does not need the solution. And as of late, there have been a lot of people who are claiming to be ADHD specialists, and they are diagnosing ADHD on the phone. They are diagnosing ADHD left, right, and center. And this is becoming very, very worrying now. It takes a trained psychiatrist with ADHD training at least a couple of hours, that is 2 hours of examining the patient, asking questions, going through everything with the parents. It takes all of the time for a trained psychiatrist who's already studied 7 years of medicine and the 6 years of psychiatry and studied on special interest in ADHD. It takes them 2 hours of face-to-face consultation to make a diagnosis. And how can anybody do this on the phone without ever meeting the patient or the parents? And then this child, this poor child, is going to be on amphetamines for the rest of their lives. So this to me is grossly unfair, and it's very unsafe practice. If you or your family or your neighbors are concerned that their child has ADHD, please make sure you see the right person. Make sure that the person you are seeing is fully qualified, is a psychiatrist with interest in ADHD, who will see you face to face, who will give you the time and the attention that is needed to make a serious diagnosis like this. This is one diagnosis that you will have to carry, and the medication you will have to carry through the rest of your life. So it is really, really important that when you are setting off on this journey, to make sure that you've got the right people on board, that you're seeing the right specialist. If you have any queries, any concerns, any questions you wish to ask about ADHD diagnosis, I'd be happy to answer your queries. Please put them in the box down below. Thank you for listening. Bye.